Question 1. Which of the following is the most appropriate personal protective equipment, PPE, to wear in the decontamination area? A. Surgical mask and scrubs. B. Eye protection, fluid-resistant gown, and utility gloves. C. Sterile gloves and a hairnet. D. Face shield and street clothes. Answer: B. Eye protection, fluid-resistant gown, and utility gloves. This question tests your knowledge of essential PPE required in the decontamination area, which is where soiled instruments are processed. The keyword most appropriate highlights the need for maximum protection against biohazards. Eye protection, a fluid-resistant gown, and utility gloves are crucial barriers to prevent skin and mucous membrane exposure to blood, body fluids, and contaminated debris. For example, if a technician is handling instruments with sharp edges or blood splatter, this specific PPE suite offers the necessary protection to maintain safety. Always remember that proper PPE is your first line of defense against workplace hazards in SPD. Question 2. What is the primary reason for performing point-of-use cleaning of surgical instruments? A. To disinfect instruments before transport. B. To remove all microbial life immediately. C. To prevent the drying of blood and organic material on instruments. D. To sterilize instruments at the patient bedside. Answer: C. To prevent the drying of blood and organic material on instruments. This question focuses on the crucial first step in the instrument reprocessing cycle, point-of-use cleaning. The keyword primary reason emphasizes the most critical objective. Point-of-use cleaning, often done by wiping instruments and keeping them moist with a towel or enzymatic spray in the operating room, is vital because it prevents blood and tissue from drying onto the instrument surfaces, making subsequent cleaning much more effective. Dried organic matter can be very difficult to remove and can hinder the sterilization process later on. Think of it like pre-rinsing dishes. It makes the final wash much easier and more thorough. Always remember that keeping instruments moist is key to preventing bioburden from hardening and becoming resistant to cleaning. Question 3. A Bowie-Dick test is performed to detect which of the following issues in a pre-vacuum steam sterilizer? A. Inadequate temperature. B. Air leaks or inadequate air removal. C. Incorrect sterilization time. D. Overloading of the sterilizer chamber. Answer: B. Air leaks or inadequate air removal. This question is about quality assurance for steam sterilizers, specifically the Bowie-Dick test. The keyword Bowie-Dick test directly points to its unique purpose. This daily test for pre-vacuum steam sterilizers checks for the efficient removal of air from the chamber and steam penetration, which is critical for successful sterilization. If air is not fully removed, steam cannot properly contact the items, leading to sterilization failure. For example, if the test sheet shows an uneven color change, it indicates air was trapped, and the sterilizer should not be used until repaired. Always remember the Bowie-Dick test is a vital check for air removal and steam penetration in pre-vacuum sterilizers. Question 4. Which sterilization method is typically used for heat-sensitive medical devices that cannot withstand high temperatures or moisture? A. Steam sterilization. B. Dry heat sterilization. C. Ethylene oxide, HCO, or hydrogen peroxide gas plasma. D. Immersion in glutaraldehyde. Answer: C. Ethylene oxide, HCO, or hydrogen peroxide gas plasma. This question asks about sterilization methods for specific types of instruments. The keywords heat-sensitive and cannot withstand high temperatures or moisture are critical clues. Steam and dry heat sterilization use high temperatures, and glutaraldehyde is a high-level disinfectant, not a sterilant for most devices, or a preferred sterilant for critical devices. Ethylene oxide, HCO, and hydrogen peroxide gas plasma, e.g., sterid, Are low-temperature chemical sterilization methods ideal for delicate, complex, and heat-sensitive instruments like flexible endoscopes or certain power tools? For example, a camera used during surgery needs to be sterile but cannot go into a steam sterilizer, making a low-temperature method necessary. Always think of low-temperature methods when you encounter heat-sensitive items. Question 5. What is the generally accepted shelf life for items sterilized in an SPD department? A. 1 week. B. 6 months. C. Event-related. D. 1 year. Answer: C. Event-related. This question addresses the shelf life of sterile items, a key concept in maintaining sterility. The phrase "generally accepted" points to current best practices. Sterile items are considered sterile unless an event compromises their integrity, such as being dropped, torn, or exposed to moisture. This is known as event-related sterility. There is no set expiration date based on time alone, provided the packaging remains intact and undamaged. For instance, a sterile package stored correctly will remain sterile indefinitely until the packaging is compromised. Therefore, always prioritize the integrity of the sterile barrier over a fixed date. Question 6. The Spalding classification system categorizes medical devices based on their risk of infection. Which category includes items that enter sterile tissue or the bloodstream? A. Non-critical. B. Semi-critical. C. Critical. D. Subcritical. Answer: C. Critical. This question tests knowledge of the Spalding classification system, a fundamental concept for determining the level of reprocessing needed for medical devices. The keyword "enter sterile tissue" or the bloodstream directly defines critical items. These devices, such as surgical instruments, implants, or catheters, must be sterile before use because they pose the highest risk of infection if contaminated. For example, a scalpel used for an incision is a critical item and must be sterilized. Remember, critical items always require sterilization to eliminate all microorganisms, including bacterial spores. Question 7. After a steam sterilization cycle is complete, what is the proper procedure for removing items from the sterilizer? A. Remove items immediately and place them on a cold surface to cool quickly. B. Allow items to cool inside the sterilizer for 30 minutes, then remove them and place them directly into storage. C. Open the sterilizer door slightly to allow steam to escape for 10 minutes, then remove packages and place them on a cooling rack. D. Allow items to cool completely on the sterilizer cart before removing them to a designated cooling area with proper air circulation. Answer: D. Allow items to cool completely on the sterilizer cart before removing them to a designated cooling area with proper air circulation. This question addresses the post-sterilization handling of items, a critical step to maintain sterility. The keyword "proper procedure" indicates a need for best practice. Allowing items to cool slowly on the sterilizer cart in a designated cooling area prevents condensation from forming inside packages, which can wick bacteria from the outside and compromise sterility. Moving hot packages too quickly can also damage packaging materials. For example, taking a hot package and placing it on a cold surface can lead to strike-through, where moisture penetrates the sterile barrier. Always ensure packages are cool and dry before handling and storage to maintain their sterility. Question 8. What is the primary purpose of a biological indicator, BI, in sterilization? A. To ensure all package contents are dry. B. To measure the exact temperature and pressure inside the sterilizer. C. To prove that the sterilization conditions were met and microorganisms were killed. D. To indicate that the sterilizer is empty of air. Answer: C. To prove that the sterilization conditions were met and microorganisms were killed. This question focuses on the most definitive method for monitoring sterilization efficacy. The keyword primary purpose directs attention to the core function of a BI. A biological indicator contains live, resistant bacterial spores that are harder to kill than typical microorganisms. If these spores are killed during the sterilization cycle, it provides the strongest evidence that the sterilization process was successful in killing all forms of microbial life. For instance, after a steam sterilization cycle, the BI is incubated. If no growth occurs, it confirms the sterilization parameters were met. Always remember that BIs are the gold standard for verifying sterilization effectiveness. Question 9. Why is it important to keep the doors to the sterile storage area closed? A. To prevent unauthorized personnel from entering the area. B. To maintain positive air pressure and reduce airborne contaminants. C. To keep the temperature consistently low for instrument preservation. D. To make it easier for staff to monitor inventory levels. Answer: B. To maintain positive air pressure and reduce airborne contaminants. This question is about maintaining environmental controls in the sterile storage area. The keyword important asks for the primary reason behind a specific practice. Keeping sterile storage doors closed helps maintain positive air pressure, meaning air flows out when the door is opened, preventing contaminated air and dust from entering the sterile environment. This minimizes the risk of airborne microorganisms settling on sterile packages and compromising their integrity. For example, if a door is left open, dust and lint from high-traffic areas could easily enter and settle on sterile supplies. Always remember that positive pressure and closed doors protect the sterility of stored items. Question 10. When transporting contaminated instruments from the operating room to the decontamination area, which of the following is most appropriate? A. Instruments should be loosely covered in a laundry hamper. B. Instruments should be placed in a rigid, leak-proof container with a biohazard label. C. Instruments should be carried by hand, ensuring they are not dropped. D. Instruments should be soaked in a basin of disinfectant during transport. Answer: B. Instruments should be placed in a rigid, leak-proof container with a biohazard label. This question addresses the safe transport of contaminated instruments, a critical step in preventing healthcare-associated infections and protecting staff. The phrase "most appropriate" emphasizes the need for a compliant and safe method. Contaminated instruments must be contained in a rigid, leak-proof container with a biohazard label to prevent spills, exposure to sharps, and contamination of the environment or personnel during transport. For example, a closed, labeled cart specifically designed for soiled instruments ensures safe movement through hallways. Always prioritize containment and clear labeling for contaminated items to ensure safety. Question 11. Which of the following best describes the function of a washer disinfector? A. It sterilizes instruments using high-temperature water. B. It cleans and then disinfects instruments using heated water and detergents. C. It is used to perform high-level disinfection on heat-sensitive items. D. It manually washes instruments before they are sterilized. Answer: B. It cleans and then disinfects instruments using heated water and detergents. This question tests understanding of equipment used in the decontamination process. The term washer disinfector describes its dual function. This machine is designed to mechanically clean instruments using various wash cycles with detergents and then provide a thermal or chemical disinfection step, making instruments safe for handling in the preparation and packaging area. For example, after instruments are pre-cleaned at the point of use, they are loaded into a washer disinfector to remove remaining soil and reduce the number of microorganisms, preparing them for sterilization. Remember that a washer disinfector cleans and disinfects, but does not sterilize. Question 12. What is the main purpose of instrument lubrication, often referred to as instrument milk? A. To sterilize the instruments. B. To clean the instruments more effectively. C. To prevent instruments from rusting and keep hinges free moving. D. To add a protective coating against scratches. Answer: C. To prevent instruments from rusting and keep hinges free moving. This question asks about the purpose of lubricating surgical instruments. The keyword main purpose directs you to the primary benefit. Instrument lubricant, often a water-soluble, rust-inhibiting solution, is applied after cleaning and rinsing to prevent corrosion, rust, and ensure that hinged instruments, like scissors and forceps, open and close smoothly. This prolongs the life of the instruments and ensures proper function during surgery. For example, if a pair of scissors is not lubricated, its joint may become stiff and eventually lock up. Always remember that lubrication is vital for instrument maintenance and functionality. Question 13. Which of the following is a critical step to ensure the sterility of flexible endoscopes after high-level disinfection? A. Drying the channels completely with filtered air. B. Immersing them in sterile water for storage. C. Storing them coiled tightly in a closed container. D. Redisinfecting them monthly if not used. Answer: A. Drying the channels completely with filtered air. This question highlights a crucial aspect of flexible endoscope reprocessing following high-level disinfection, HLD. The keywords critical step and after high-level disinfection are important. After HLD, all channels and external surfaces of flexible endoscopes must be thoroughly dried with filtered air or alcohol followed by filtered air to prevent the growth of residual microorganisms, especially waterborne bacteria. Moisture left in the channels can foster bacterial growth, potentially leading to patient infections. For instance, if an endoscope is stored with wet channels, bacteria like Pseudomonas could multiply. Always ensure complete drying of endoscope channels to maintain their reprocessing efficacy. Question 14. What is the correct way to handle a package that has been processed through a sterilizer but has a torn wrapper? A. Use it immediately, as the inner contents are still sterile. B. Rewrap and re-sterilize the package. C. Discard the package and reorder a new one. D. Consider the contents contaminated and send them back to decontamination. Answer: D. Consider the contents contaminated and send them back to decontamination. This question addresses a common issue encountered in SPD regarding sterile package integrity. The keyword torn wrapper signifies a breach in the sterile barrier. Any breach, tear, or hole in a sterile package compromises its sterility, rendering the contents contaminated. Therefore, the items must be considered unsterile and sent back to the decontamination area to be reprocessed from scratch. For example, if a sterile instrument set is dropped and the outer wrap tears, it cannot be used and must go back through the entire cleaning, packaging, and sterilization process. Always remember, if the sterile barrier is compromised, the item is no longer sterile and must be reprocessed. Question 15. The term asepsis means: A. The absence of all microorganisms. B. The absence of pathogenic microorganisms. C. The process of rendering an item sterile. D. The use of chemicals to kill microorganisms. Answer: B. The absence of pathogenic microorganisms. This question defines a fundamental term in healthcare. The keyword asepsis refers to practices that prevent infection. While sterilization aims for the absence of all microorganisms, asepsis focuses on creating an environment or performing procedures free from pathogenic, disease-causing microorganisms. This is achieved through techniques like hand hygiene, sterile gloves, and maintaining sterile fields in the operating room. For example, performing a surgical procedure using aseptic technique helps prevent surgical site infections by minimizing the introduction of harmful bacteria. Always distinguish asepsis, preventing infection by excluding pathogens, from sterilization, eliminating all microbial life. Question 16. What action should be taken if a sterile tray falls on the floor in the operating room? A. Return it to SPD for immediate re-sterilization. B. Wipe it off with an antiseptic and place it back on the sterile field. C. Consider the contents contaminated and remove the tray from the sterile field. D. Inspect the packaging for tears before deciding. Answer: C. Consider the contents contaminated and remove the tray from the sterile field. This question tests understanding of maintaining sterile integrity in a clinical setting. The phrase "falls on the floor" is a clear indication of contamination. When a sterile tray or any sterile item falls onto a non-sterile surface like the floor, its sterility is immediately compromised, regardless of whether the packaging appears intact. It must be considered contaminated and removed from the sterile field to prevent patient infection. For example, if a sterile instrument set falls, it cannot be used for surgery and must be reprocessed through decontamination, packaging, and sterilization. Always remember, if sterility is questionable, it's considered contaminated. Question 17. Which organization establishes standards for the processing of reusable medical devices in healthcare facilities? A. OSHA, Occupational Safety and Health Administration. B. FDA, U.S. Food and Drug Administration. C. AAMI, Association for the Advancement of Medical Instrumentation. D. The Joint Commission. Answer: C. AAMI, Association for the Advancement of Medical Instrumentation. This question identifies a key standards-setting organization in the field of medical device reprocessing. The keyword "establishes standards for reusable medical devices" points directly to AAMI. AAMI develops and publishes voluntary consensus standards, recommended practices, and technical information reports that guide healthcare professionals in the sterilization and processing of medical devices. While other organizations play roles, like OSHA for safety, FDA for device approval, and Joint Commission for accreditation, AAMI is the primary source for device reprocessing standards. For example, the standards for steam sterilization cycles are primarily outlined by AAMI. Always recognize AAMI as the go-to resource for SPD best practices. Question 18. What is the purpose of the deionization process in water used for instrument reprocessing? A. To add minerals that help clean instruments. B. To remove impurities and ions that can stain or damage instruments. C. To increase the conductivity of the water for better cleaning. D. To sterilize the water before final rinse. Answer: B. To remove impurities and ions that can stain or damage instruments. This question addresses the importance of water quality in instrument reprocessing. The keyword deionization refers to the removal of ions from water. Deionized water is crucial for the final rinse of instruments because it removes dissolved minerals and ions that can cause spotting, staining, and corrosion on instruments during sterilization. Using deionized water prevents water spots and helps ensure instruments remain in good condition. For instance, tap water can contain minerals like calcium and magnesium, which would leave white spots on instruments if not removed. Always ensure high-quality water for instrument cleaning and rinsing to protect their longevity. Question 19. How frequently should the mechanical cleaning efficacy of a washer disinfector be tested? A. Annually. B. Monthly. C. Daily. D. Weekly. Answer: C. Daily. This question focuses on the routine quality assurance for automated cleaning equipment. The keyword frequently for mechanical cleaning efficacy points to daily monitoring. Washer disinfectors should be tested daily using a soil test, such as a protein-based test, to ensure they are effectively cleaning instruments. This daily testing verifies the machine's functionality and that all parameters like water pressure, temperature, and detergent dispensing are working correctly. For example, if the daily test shows remaining soil, the machine needs maintenance before it can be used for patient care items. Always remember that daily testing of washer disinfectors is crucial for patient safety. Question 20. When manually cleaning instruments with lumens, what is the most important step? A. Soaking them in a strong disinfectant overnight. B. Using a soft cloth to wipe the outside surface. C. Flushing the lumens thoroughly with a brush and cleaning solution. D. Placing them in an ultrasonic cleaner without manual pre-cleaning. Answer: C. Flushing the lumens thoroughly with a brush and cleaning solution. This question highlights a critical aspect of cleaning instruments with internal channels or lumens. The keyword lumens and most important step directs attention to the unique challenge of cleaning these narrow passages. Lumens must be thoroughly flushed with an appropriate cleaning solution and brushed to remove all organic debris and biofilm, as these areas are difficult for cleaning solutions to penetrate effectively. If lumens are not meticulously cleaned, microorganisms can survive and compromise sterilization. For example, an endoscope, which has multiple lumens, must have each channel meticulously brushed and flushed to ensure it is clean. Always remember that thorough manual cleaning and brushing of lumens are essential before disinfection or sterilization. Question 21. What information should always be included on a sterile package label? A. Patient name and surgeon. B. Date of sterilization, sterilizer number, and lot number. C. Cost of the item and vendor name. D. Preferred storage location and inventory count. Answer: B. Date of sterilization, sterilizer number, and lot number. This question asks about the essential information required on sterile package labels. The keyword "always be included" indicates a mandatory requirement for traceability and quality assurance. For every sterile package, it is crucial to record the date of sterilization, the specific sterilizer used, and the load/lot number. This information allows for traceability in case of a recall or a sterility failure, enabling identification of all items processed in that specific cycle. For example, if a biological indicator fails, these details help identify every item from that affected load. Always ensure complete labeling for proper tracking and patient safety. Question 22. What is the primary function of the holding area or dirty utility room in the SPD workflow? A. To perform final sterilization of instruments. B. To store sterile instruments before distribution. C. To receive, sort, and contain soiled instruments prior to decontamination. D. To conduct quality control checks on sterile packages. Answer: C. To receive, sort, and contain soiled instruments prior to decontamination. This question addresses a specific area within the SPD department workflow. The keyword "holding area" or dirty utility room points to its role in the initial handling of contaminated items. This area is designated for the safe receipt, sorting, and temporary containment of used or soiled instruments and equipment before they enter the main decontamination process. It acts as a controlled space to minimize the spread of contamination. For example, surgical trays are brought here from the operating room before being disassembled and manually cleaned. Always remember this area is the first step in the reprocessing cycle for contaminated items. Question 23. Why is it important to ensure that instrument sets are not too dense or heavy when preparing them for steam sterilization? A. It makes them difficult to transport. B. It can prevent proper steam penetration and air removal. C. It causes the instruments to rust more quickly. D. It increases the cost of the sterilization cycle. Answer: B. It can prevent proper steam penetration and air removal. This question emphasizes a crucial factor in effective steam sterilization. The keywords "not too dense" or "heavy" highlight an issue that directly impacts sterilization efficacy. Overloading or creating too dense a tray can impede steam penetration into the instrument lumens and surfaces, and hinder efficient air removal, leading to incomplete sterilization. Steam needs to be able to contact all surfaces of every item for sterilization to occur. For example, if a tray is packed too tightly, the items in the center might not reach the necessary temperature for the required time. Always remember that proper loading is essential for steam to reach all surfaces and ensure sterility. Question 24. A critical component of daily quality assurance for an automated endoscope reprocessor, AER, is to A. Calibrate the unit with a certified technician weekly. B. Visually inspect the endoscope for damage after processing. C. Verify that the minimum effective concentration, MEC, of the high-level disinfectant is met. D. Change the disinfectant solution only when it appears cloudy. Answer: C. Verify that the minimum effective concentration, MEC, of the high-level disinfectant is met. This question focuses on a vital daily quality assurance step for automated endoscope reprocessors, AERs. The keyword "critical component of daily quality assurance" for an AER points to the need for regular chemical testing. It is essential to test the high-level disinfectant used in an AER daily, or sometimes more frequently, to ensure it still has the minimum effective concentration, MEC, required to kill microorganisms. If the MEC falls below the recommended level, the disinfectant will not be effective, and the endoscope will not be properly reprocessed. For example, using test strips to confirm the concentration before each use ensures the disinfectant is potent enough. Always remember to verify MEC for high-level disinfectants in AERs daily. Question 25. What is the correct method for counting instruments on a surgical set after a procedure? A. Count instruments on the surgical field at the end of the case only. B. Count instruments both before the procedure begins and after it concludes. C. Count instruments only as they are removed from the sterile field. D. Rely solely on weight to determine if all instruments are present. Answer: B. Count instruments both before the procedure begins and after it concludes. This question addresses a fundamental safety practice in surgical settings. The keyword "correct method for counting instruments" highlights the importance of accountability. Instruments are counted at least twice, before the procedure to ensure all listed items are present, and after the procedure to confirm all instruments are accounted for and none are inadvertently left inside the patient. This meticulous counting process prevents retained surgical items, a serious patient safety issue. For example, the circulator and scrub person typically count together at the beginning and end of a case. Always remember that accurate instrument counts are critical for patient safety and preventing complications.